The coronavirus pandemic has been referred to as the great equalizer, with its impact being felt by both rich and poor for the past 2 years. However, with the advent of vaccines to combat the spread of the virus, a great divide has now been exposed, that of inequity and imbalance between developed and developing countries. Last week, South Africa detected a new COVID-19 variant called the Omicron. The discovery of the new variant has infuriated Southern African countries, where Omicron was first detected. Many countries in the West have been called out for their apparent hysteric curbs and for not giving a chance to the scientists to probe the effectiveness of the vaccines on this new mutant strain. Once South Africa announced the presence of Omicron, most countries, fearing that Omicron could have serious ramifications, suspended travel to and from the South African region. Speaking on the quote-unquote discriminate travel bans, South African President Cyril Ramaphosa cautioned against the hasty restrictions and notions being propagated by the West. Now, the variant was detected last week in Botswana and South Africa, and since then it's been found in countries across the globe, from Scotland to Canada. It's still unclear where the latest known strain originated. And now a recent report suggests that the Omicron coronavirus variant was present in Europe before the first cases were reported in South Africa. This data was released by the Netherlands. The WHO believes the high number of mutations in the new variant may make it more transmissible or resistant to vaccines. The mutations were found in 2 Dutch test samples from November 19th and 23rd, and one of the cases had no travel history. There's a lot of uncertainty that surrounds the Omicron variant. Medical experts in South Africa have said that they haven't seen any extreme COVID cases from this strain. There have even no Omicron-related deaths in the world either. And now, Botswana's health director said that Omicron patients are most likely asymptomatic.
So far, what we are seeing from most of the contacts of these first 19 cases, most of them have tested negative. And we are continuing to follow them up during their quarantine period to say, on completion of quarantine, have they actually incubated the virus? But so far, all the contacts have tested negative, and most of the cases themselves, really, nobody had any symptoms. 1 or 2 people might have had a few mild flu-like symptoms, but resolved in 1 or 2 days. But the rest, really, nobody has been symptomatic. And I think for now, it is a good sign.
There's not much known about the impact of this new mutation. The World Health Organization and the United Nations urged countries not to panic and rush into making their decisions, further urging governments to stop what is now being referred to as travel apartheid. WION is now available in your country. Download the app now and get all the news on the move.